Based on the information provided in Miguel's case, a 10 years old Hispanic male, he exhibited some symptoms consistent with the anorexia nervosa, and that includes significant weight loss over the past year, being picky with food, and only having preferences for food and liquid, and preoccupied with food and eating, as evidenced by his mother reported that he's afraid he will get sick to his stomach if he eats. So based on all these informations, it seems like it's aligned with atypical and anorexia nervosa, and I think that is because it involves restricting food intake but not meeting the low weight criteria for a typical anorexia. So yeah, but of course there are other things that we would need more information on to accurately diagnose Miguel, such as looking at his age, underlying anxiety, fear of getting sick. People who have fear of getting sick might relate to a specific phobia, and yeah, and some of the psychosocial and contextual factors that might affect the diagnosis or treatment. In Miguel's case will be his family history of mental health condition. Since Miguel is currently on medication and has history of anxiety, there might be a high chance that his family has mental health condition as well, which will put him a lot at risk for eating disorder. And another one will be culture factor. In some culture, thinness is seen as the desired body goal, whereas in other culture, being thin was seen as anorexia. And yeah, and social factor as well, that is something that we should look at. In school, Miguel might go through bullying, which causes him to, bullying about his weight, which might cause him to restrict his diet, foods intake. And to look at Adlerian's theory, Adlerian will see this as feeling inferiority. So Miguel might be struggling with feeling inferiority since maybe his peer bullying him about his weight, so that he want to meet the desire of, and striving for superiority. Adlerians say that people are motivated by desire for superior or control. So by controlling his diet and intake, he might feel like he's in control of something in his life. So yeah, and there's a research study by Belenji 2007 on couple and eating disorder, and they mentions and Adlerians and views on eating disorder, like I just mentioned, such as feeling of inferiority and lack of belonging. So the article mentioned how they will help the couple find the underlying feeling of inferiority and develop healthy coping mechanism. So and they say that the Adlerian therapy can contribute to a more effective treatment and empower partner to just address and communicate the underlying issue of their problem. And another article that I found by Colesman, Joe, and his colleague, 2022, they mentioned how self-compassion and express emotions is really effective, and child who struggle with eating disorder, and they found a link between higher self-compassion in caregiver and low level of expressed emotions toward the child with eating disorder. So what can we learn from this research? We can learn that regarding Miguel's case, if we, as a caregiver, if we taught him how to practice self-compassion, he might be better equipped to managing his emotion and respond to his struggle in a supportive and understanding way, and which so that he doesn't go on the extreme end to an eating disorder symptoms. Thank you.